also different, but the objectives and the some standard of a basic standard of training, I think, is very common all around the Asia Pacific region, except some countries. Still, we should develop some family physician in underdeveloped countries such as Laos, Cambodia, Mongolia, and even in mainland China. Mainland China is now developing so earnestly to get GP more. They now plan to have very many GPs now, especially Shanghai local government is very active to develop GP system. And in Korean situation is now we are 10% of all physicians are family physicians. Still we are lacking in terms of number of primary care physicians. But in Korea it's a little different because we are very in healthcare system is very open market, open market. It's very competitive and market driven. It's very competitive state. From hospitals and private clinics and public hospitals, all mixed and not well organized in terms of their roles and their service catchment area or something. So in those of very mixed state, family physician is very hard to serve their communities and their patients because there's no gatekeeping role for primary care physician in Korea. So, but in the future, I think that's very optimistic because anyway, all the countries, especially Korea, is aged society, and the healthcare cost is very much increasingly rapidly increased. So government is very concerned about that, and they anyway hope the system is well organized to deliver the service to one who need the most. So also their role should be well carried out by efficient family physician. So I think that government will more. Still, we are very well recognized, but government will support us. I hope support us.
So,
and in Asia Pacific, I don't know well, but as a president, I see that there are many countries still, struggle to. Some countries already, get well recognized in family physician, well recognized. But some countries still, struggle to get some recognition from their government or their people. So still, it's very diverse, as you know. As like Asia Pacific is from Mongolia to New Zealand. There's so many diverse areas. So it's like the same in family physician status, and the healthcare system is also like that, very diverse.
A few quick words on the future of family medicine in Korea.
Future. Yes, I already said that this kind of social change encourage us to get more involved in the healthcare system. Also, maybe government and the society feel need of and lack of family physician or general practitioners in their society. And I hope maybe now it's just 10%, but we will be very hard to get more medical students to general practitioner track, and they also some financial reimbursement system for GP, and it's very differential. But the hospital reimbursement is well organized, but the GP reimbursement system is not well. So it's, I think not only family physician but also even specialists in private clinic is very unhappy to the reimbursement system of healthcare. So I think more such some unreasonable policy should be corrected to help our discipline is more acceptable to our community and
Okay. So Chiki, thank you very much.
Thank you. you
I wouldn't want to answer that. It can be too critical. If you want my honest opinion, I'd rather not answer that question because the aspirational part, I think is okay.
Yeah, maybe the aspiration, what you hope family medicine to be like.
Well, I think my personal hope is that I think everybody recognizes the fact that the importance of a family physician in any country. And I think for Malaysia, we've been thinking about it. The first phase has been gone through, as I understand it. What we are waiting for is now the second phase, the involvement of the private practitioners, the GPs especially. So as far as the government sector is concerned, I think they've been doing a fantastic job. Now with the issue of public-private integration, I think we would like to see that coming into effect. We've been given the task of upgrading the general practitioners, starting with the diploma in family medicine, and with another 2-year program for the advanced training program, and leading to the professional qualification of the conjoined examination between the Malaysian and Australian academies. And this is what we are doing now, and currently there are about 700 people on the course. So what we hope now is that, of course, that at the end of the day, by putting these people and to show the government that we are ready now, and we certainly hope that that second phase comes into effect. As it is, I think everybody understands that the budget, healthcare budget is ballooning so much, and something has to be done. And I would like, my own personal aspiration is that I would like to see us really practicing family medicine in the full context as it is in what other developed countries like UK and Australia, probably Singapore also has started. This is where we're laying the ground. The government is looking for us to prepare a number of doctors. We're moving in that direction. We hope the political will also comes in at the same time, and that will be good for the country. The first phase, like I said, as far as the public services in primary is concerned, I think is a fantastic job done by the Ministry of Health. Now the private practitioners, myself I've been 25 years in private practice and now decided to enter an academic. I'm still fighting for the cause of the private practitioners with an interest in primary care management. So that personally is what I've been fighting for all along. And that's my personal aspiration. I don't know what problem my Singapore colleagues probably do the same thing, but I think you're one step ahead of us. Okay, that was my aspiration.
我想跟新加坡一样，是面对一个高龄化的社会，
Okay.
所以一个家庭医师的养成它应该有包括3个方面。第一个当然是他做全科医师的事情，做 primary care physician， 做一个医疗体系的 gatekeeper。但是另外一个面对老人社会的问题，一个是老人医学的一个训练。老人医学它强调的是预防失能。因为我们目前的医疗的一个体系都是以疾病为中心，工科化的医疗，同时重视科技，缺乏人性化的照顾。所以面对老人的一个照顾，他强调的是功能的一个维持跟提升。所以在一般的老人的检查里面，一定要加上一个身体功能，那他的一个认知功能、情绪功能，以及他的沟通跟自我照顾功能，这个方面的检查，在目前的所有的健康检查、成人健康检查是没有包括在内的。另外一个就是老人一定要面对到他生命末期的问题，所以怎么样让
生命末期是什么？
生命末期就是
英文
terminal disease，end of life care，
好，
末期的照顾，所以要强调的是一个 palliative medicine。所以，一个家庭医师的养成，或者是一个家庭医学要发展的领域，除了传统的全科的照顾，那 comprehensive care 就是熟悉系 2A 的照顾，熟悉系这样就是 comprehensive
continuous
coordinating 跟 accountability accessibility 以外，要重视老人医学的训练，要重视 palliative medicine 的训练。
What do you see is the future of family medicine in Taiwan?
Taiwan, yes, that's very good. 那是非常重要的问题，也是我们努力的目标。那台湾的一个家庭医学的发展，跟保险制度、跟政府的政策是结合在一起的。那我们的全民健保、健康保险是从1995年开始做。那现在已经面对到财政的恶化，不得不来增加这个给付，所以我们在2010年通过2代健保，它 它有个补充保费这样的一个提高这个健保的一个收入的情况之下，它要求要实施家庭责任医师制度。所以那个我们目前就是台湾的一个家庭医学的发展，它的一个目标就是要全民每个人都有一个家庭医师，同时这个家庭医师是要负责做3全的照顾，全人、全家、全社区的照顾，这个是我们目前台湾家庭医学正在努力的目标。
哦，很好，好，谢谢你，陈医生。
好，谢谢。
拍一张你的。
比你回调更多。
第一个是the problems you see in family medicine in Taiwan。
好
你可以用中文用英文。
说的是哪方面
？problems， 说2-3个problems。primary care。用中文也可以。
你要讲的是 policy 的东西吗？
简单的一两
对，就是台湾因为是一个 universal coverage under the health insurance national health insurance， 所以这个对医生来说呢，就是这个整个 medical expense 变高了，但是 government support 并没有变多，所以这个医生每天看很多的病人，但是 payment 的部分反而是有 discount， 这是第一个部分的问题。那第二个部分的问题是，government 目前的重视的主题还是以 hospital 为主啦。那台湾因为很多人都没有办法做那个叫做分级医疗没有 gatekeeping 的概念，所以民众是可以 free doctor shopping， 所以变成他们对基层的 community care 没有很重视啦。但是这事实上是花费更多的医疗的成本，所以我觉得这是一个比较重要的问题。好，这两个问题。好，
那么你看台湾 family medicine 的前途是怎么样？
前途吗？我觉得还是很好啊，因为在台湾的 family doctor 他们在3 to 4 years 的resident training 之后呢，我们还有其他 multiple 的 discipline， 比如说我们会去 engage in obesity care，这个 travel medicine，还有 geriatric medicine、hospice care。那很多人还去念这个 master's degrees about public health，所以像我自己还有念 hospital managing， 所以变成说我们除了我们本来的这个医学的专业以外 ，as a specialist or a family doctor， 我还同时可以做一些其他方面的一个发展。那台湾有很多的所谓的 quality care 的 program， 我们有5项 asthma、diabetes、CKD， 然后还有这个 TB， 还有BC hepatic B or hepatitis B or hepatitis C 的 care， 它有encourage or incentives for the doctors to perform。那 family medicine 的 specialist 是唯一，他可以 go through all 的，可以 join all 的project。对。所以对于台湾家庭医师，我觉得是一个还是很好的发展。
好 ，OK， 谢谢你，
谢谢。这个是要。
I think the main problem with our country is just a structure at the moment. I think we're still halfway between what a family physician should be. So we're trying to bridge that gap. What I mean is basically we're still, because of the numbers, so we're very much unable to be based in our particular area to cover that particular catchment area. So we've been pulled around a lot, and that actually affects a lot of our continuity of care. Now, I'm not sure about Malaysia, but I think they've got similar problems when they're actually just moving around too much. Whereas family medicine, a family doctor physician will be in charge of actually being there and seeing the community doctor. So I think that's very much what we try to plan to be more in the future. But of course, we need the numbers, we need the coverage, enough doctors. Other problems, well, I think basically a lot of education we still need for the general public. Utilization of the right services. A lot of people just come to the clinic wanting, random things. There's still a lot of things that we need to do with chronic healthcare, chronic disease management. A lot of things.
Okay, so moving forward, what do you see is the future of family medicine in your country?
Recently, there's I think some people from America just came and had a little study. but because of the population size, they actually advise Brunei to change more to a smaller, not smaller, less amount of health centers, but bigger practices, which incorporate multiple disciplinaries, such maybe like similar to like polyclinics, where we can have minimal cardiology investigations, which covers a bigger catchment area. It's something that I think the ministry is looking into whether we can change to that. We actually have some family physicians, family doctor specialists, who's gone to UK to do specific like GP with interest in diabetes management and cardiology. So I think, and dermatology as well. So I think when they come back, it's possible to set up this kind of clinics where we have GP special interest in charge of a bigger health center covering bigger catchment areas. Can more streamline more of the services.
Okay.
Medical University.
Yourself too?
Yamaguchi Grand University for rural medicine.
Rural medicine. So what is the scope of family medicine? You treat the patients in around the university, is it?
Yes.
Okay.
This university is GT Medical School next to Tsukuba. Next to Tsukuba. Do you know Tsukuba? I am Yamaguchi Prefecture is west main island in Japan.
Okay. So you're not from the same place?
So we are the same medical school. We graduated.
Okay. But now you work at different places. I see. So what do you think of the future role of the family physician? Is there a need to change the role or expand the role? What do you think?
Difficult question.
In Japan, so government start new system. So family medicine is 19th correct development of the specialist. So I think family medicine is one of the specialists. So this is very good chance for family medicine in Japan.
So government is making primary medicine as one of the specialties.
Yes. Or 19th.
The 19th specialty. So you think that will advance family medicine? So do you see that there is a bigger role for family medicine doctors now with your aging population, and what do you think needs to be done?
Right, very aging country. In Japan, there are many doctors, but local residents need more doctors in their own city. So the reason why one of the reasons is each specialist. There are each specialist, but primary care physician or family medicine physician, there is
very few.
very few.
So although there are many doctors, you need more doctors because most of the doctors are specialists. So you don't have enough family medicine doctors.
So the role of family doctor is needed.
Okay. So are you involved in training young family doctors? Are you involved? The medical university? Okay. Alright. Yourself also? You are training young doctors to be family medicine?
I have my program for graduate training program for family medicine.
Okay.
So I presented today by poster.
Oh, okay. Are you with Dr. Ben? No, Ben.
Dr. Ban.
Dr. Ban.
I know Dr. Ban. Over there.
Dr. Ban is also he helps the residency program.
In Japan?
Yes.
In Japan?
What the new roles that the physicians should play?
So in Japan, as you know, the elderly patients are becoming more and more. So geriatric care and also the home care is much more important than before. And so we are trying to see the elderly patient in their home, and also the palliative care in the home. Yeah. So
It's exactly the same situation in Japan.
yes.
Many elderly patients, and we need to know how to manage them in their last days, and so there's a role for medicine.
Okay. And also, we have to work on to broaden the scope of the practice, because many family doctors work as internists and also sometimes see the children, but they don't see much musculoskeletal problem or women's health. So we need to broaden the scope of practice in Japanese family medicine.
You mean Japanese women don't go and seek screening and all that?
No, we have the orthopedic clinic with so many clinics. So the special clinics are easily available. That's why.
Dr. Suda says we need to expand the role of the family physician into preventive care for women. You're talking about preventive care for women?
Yeah.
So palliative care, preventive care for women,
Care for women.
and home care.
And it's very much Thank you.
Okay, thank you. Hi, David. Hi. Would you like to tell us what draws you and made you do family medicine?
Yeah, sure. So I used to be a designer, and I used to work in media. And to be honest, there was two things. I moved to the country, and I loved rural communities, and I got exposure to a lot of amazing GPs who were GP obstetricians. So they were GPs part of the time, and the rest of the time they delivered babies in these country towns. And I wanted their life. I looked at their life and what they did, and I went, I want that. That's who I want to be. I loved everything about it. And the other thing was that the job I was doing in advertising, you know, it's fun, but it doesn't really give you the satisfaction of helping people. I mean, the thing I love about general practice and family medicine is that you connect with people, and you don't just see them once, you see them for a lifetime. And for me, that's amazing. Because medicine should be about people and communication and sharing yourself with others, and I think that's the thing that really drives me to be a GP.
Fantastic. And what do you see of the future of family medicine in Australia?
At the moment, family medicine is going through a weird phase in Australia. There's really positive things, and then there's some really negative things. So the positives are that a few years ago there was more places for GP training than people who wanted to do it. So you used to have 600 GP training places and 450 students applying to do it. Now we have 1,200 places and 2,500 students applying to do general practice. So it's gone from very unpopular to very popular. And they've just increased the amount of training places to 1,500 for next year. So that's really exciting. But they've also, the government is potentially introducing a $7 fee or co-payment to go and see a GP. So previously it was free. It was universal healthcare for all. You know, if you couldn't afford to pay, you didn't pay. Now everyone has to pay. So GPs, every doctor in Australia is currently up in arms about that. So trying to get the government to change their mind, or at the very least introduce some conditions on this so that people who are with chronic disease, people who are aged, people who are poor, children don't have to pay. So that's going to be something to watch. I'm sure it'll be in the papers over the next few months.
Okay, David, thank you very much.
Thank you.
Thank you.